I would like to call to order the April 6, 2020 Cabarrus County Board of Commissioners work session. Welcome, everyone. This is a little bit of a different type of meeting than what we're all accustomed to, and certainly a sign of the time. I am meeting today sitting at my dining room table. I think all of our other commissioners are in their homes, and various other folks involved are at different locations around the county. Hopefully, we are setting a good example for all of you out in the public of how important it is to stay at home as much as possible, to not gather in groups, and try to get through this situation as quickly and painlessly as possible. And certainly everyone's health and safety is the number one item on the agenda. But first up on our agenda today is approval of the work session agenda. And all of you have copies of that before you. Do I hear a motion that we approve the work session agenda as presented with any changes that have been added?
Move for approval.
Yep.
Okay, I heard a motion from Commissioner Honeycutt, a second from Commissioner Shue to approve the work session agenda. All in favor, please say aye.
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 All opposed, no. That motion passes. And we move now to discussion items. First up, we have Kyle Billifer and Londa Strong to give us an update on the Frank Lisk Park barn fire. Welcome, folks.
Good evening, Board of Commissioners. I will go ahead and start it off. And if Londa wants to jump in, I'm sure she will at the end. But I just kind of wanted to give you an update of where we are with the whole process of the barn fire. The fire took place at approximately 12:40 a.m. on March 26, 2020. It first displayed itself as fire alarm troubles and a loop issue. That was most likely the flames burning through some of the cabling. And then it went into a security system for motion sensors, which was most likely the smoke. Upon responding, our sheriff's department saw that the building was on fire and made the call back to 911 to dispatch the fire department. Most of the leadership staff of the infrastructure and asset management department was there by about 10 minutes or 15 minutes after 1 a.m. And stayed there probably till about 4 a.m. And I did have Lauren queue up a video to show you what that did look like. And if Lauren, you want to play that now, and then I'll complete speaking afterwards.
I think she's pulling it up.
Okay, thank you, Lauren. As you can see, the extensive damage was on the right side of the barn and the silo. You are able actually still to access the stairs on the left side. It is still an active investigation site, so we do have construction fencing around the entire area, and then an actual tape and barricade barrier probably about 10 feet out from that. So I have met out there with the infrastructure and asset management staff with about 7 different folks from our insurance carrier with Travelers, which is who our policy is with. I'm in calls with them on a daily basis and providing them with a lot of information about the actual materials that were inside, and the numerous upgrades that we've done in the barn in the last 15 years. So we are moving forward with that, and they are moving forward with their estimation. And I will be back up in front of the board in the next few months to continue to talk about that. We have requested in advance from our policyholder, from Travelers, and they will be giving us an advance of $100,000. And that is obviously to start to cover the next steps, which will be demolition. We're working with a contractor right now on getting that information, but obviously we cannot move forward with any demolition until estimates are put together by our insurance provider and until the investigation is complete. So none of that is in the immediate future in terms of demolition. We would have to see all those estimates and agree with them prior to moving forward with that demolition. In addition, the county hired their own structural engineer to go out and look at the silo. The video did show a lot of flames in the silo, but I wanted to make sure that that was in fact structurally unsound based on the fire. And I don't have that official report, but after talking to the structural engineer today, I feel confident that that is going to be not just the insurance company's opinion, but also our independent structural engineer. And to give you an update about what our coverage has, it's very in-depth. We have a $250 million coverage for all of our buildings in the county. And we also have a $5 million code coverage, which the actual verbiage for that is called a building ordinance or law upgrade policy, and it's up to $5 million. And I bring this up to the board now because the size of that building, the way that it stood, and being 2 stories, it had no elevator and it had no sprinkler system. So understand that as we move forward and we investigate the possible programming and feasibility of building something back like that, those issues will come up. If it is to be built back the size that it currently was or is, there would need to be a lot of code improvements, and that will be a substantial cost. So I'm working with the insurance provider very carefully on that, because there's some intricacies of installing a fire sprinkler in a building like that when you don't have the diameter of water lines you need in the park to provide the water for a suppression system. So there's a lot of dominoes. So I wanted to discuss this with the board and get an inkling of if you wanted the county to move forward with an RFQ for architectural services, not so much on design of a new building, but more on a programming and an infrastructure feasibility of what we could build there. Again, we do have some advanced funding coming from that carrier, and I am going to need some direction moving forward in the next few months if that's something the board would like us to pursue. And again, this is not a decision whether to build it back. It's more of a decision of if we did build it back, what would we be looking at in sheer volume and ideas of cost. And now I will kind of leave it off to Londa. I think that she probably wants to speak about a lot of the comments that they've gotten from the patrons and staff.
Yes, Kyle, that is one of the things that I wanted to talk about. It's amazing how many emails and texts and phone calls that we have received from people that don't even live around here, or maybe used to, or just heard about it and have been to a picnic or a wedding or something. And I would think that, or would say that the majority of the people have said, when you building the barn back, because we want to be in it. And that's one of the things that we've talked about is, a barn again. And Kyle and I have talked, and he's let me know about all of the additional costs, making it accessible, having appropriate water. But that's just one of the things that we would really like to see is the barn back again. Silo, not that big of a deal, especially since it just sat there and we couldn't go in it anymore, but definitely the barn. I mean, some of the stories that we've heard, one family goes all the way back to 1986, and the grandmother started having Easter dinner there, and they have done that every year since 1986 in the barn. even after the grandmother passed in 96, I believe it was. And they still had continued to do it. And there's so many stories like that we've heard from people we don't even know. But I just wanted to share that with you all. I thought that was pretty important. And one thing that I got today was a report on refunds that we've given for the park up to this point. And it's close to $19,000 that we have, and we can only go out for a year on reservations. So that's just through the end of, depends on what year you look at, calendar or fiscal year. So that's just for the barn. That doesn't include with the shelters being shut down since March 16th.
Thank you, Londa and Kyle. Certainly a very tragic event for our community, and as Londa mentioned, a tremendous amount of memories and special events that have happened for people all over the county at that location. Do any of the other board members have questions or comments regarding the barn and the fire?
I just had one question, Mr. Chairman, and that was for Kyle. What kind of deductible did we have on our insurance policy, Kyle?
$25,000, sir.
Thank you.
Yes, sir.
Anyone else? Well, I think Kyle was actually wanting a little feedback or initial direction on where we want to go on the potential replacement of that facility and so forth. And just to give my opinion on it, I think it is a very important part of the park. Londa could certainly probably give us some usage figures for what goes on out there, but it's a tremendous number of events. And I think whether it would be, and I'm assuming that repair, that building was damaged beyond repair. Is that correct?
Yes, we feel confident that it's more than a 50% loss. I did work with Todd Culp and Matt Love from the Construction Standards Department of the county, and they did speak with some of the folks at the state. And based on what we saw and what we walked through, structurally speaking, I don't see how you could build it back with what is there, and I don't think it would be approved.
So it would be just a total demolition and then replacement of whatever we chose to do.
That's how we're treating it, sir, yes.
Right. Well, I think Londa could probably speak to the fact that a space of that type of some sort is definitely important to the operation of that park. Would you agree, Londa?
Oh, most definitely. That has been the focal point of the park since it opened in 1982. That is people, and Perry was telling me the other day that people call and say they want to make a reservation of the park, and he tries to get them down to what specific item, and they're referencing the barn because that's what they associate it with.
Exactly. Any other questions or comments?
Just a quick question. We've never had to contemplate the barn not being where the barn currently is. So if it's a total loss and we have total demolition, does it make any sense to then take a look around and see is there a better spot for it to go, or do we know that it needs to just go back on the, does it, now that we're sort of free of the location, do we need to take a look around and see if it needs to go somewhere else inside the park?
I will speak infrastructure-wise, and then I'll let Londa speak to everything else. So it's not going to benefit you in terms of your water line placement if we went somewhere else. Technically, the answer is the insurance will pay for replacing a building of that size wherever it may be, whatever footprint we choose. So exactly what you're describing can in fact be done. And that was kind of where I was looking for some guidance in terms of possibly doing an RFQ for an architect to look at the programming of what's needed for that building, and look at where the best infrastructure to build something like that is if it's not in the existing footprint. But I'm right off the top of my head, I could only think of one other location in that park that would have that size, and there would be a lot of amenities that you would need to add there that you don't currently have at a potential other site that you do where it currently sits. So again, I tell the board this: the insurance company is going to pay for what's there and what burnt down. If there are other things we have to add because we want them, or they're not existing where we want to move it to, they're not going to pay for that. Whether it be a parking lot, electric lines, things like that, that's not going to be part of that. They're going to replace what was there, financially speaking.
Right, right. Well, I'm just curious if part of the RFQ would be to take a look at the site and make the determination that, yeah, it absolutely makes the most sense to put it exactly where it used to be, or, hey, we now can do X, Y, Z if the barn goes over to this other spot. And off the top of my head, I can't think of anywhere it would be better, but I'm not there every day. So that was just, it's just a curiosity, and it, you know, not to drive up a whole bunch of cost on the planning piece of it, but it may be at least worth the question to ask.
If you'll agree with us to go ahead and move forward and bring somebody on board, a professional on board to help us, we can bring you back all sorts of different options, locations, appearances, sizes of the building that for you to consider.
I agree with
I would
that.
say, yeah, that we should move forward with the RFQ, and we should talk with LONDA and everybody to determine what's the best usage, cost effective, and everything else. The next item we're going to talk about is the lease renewal for the park anyway. So I think all of those things will be tied in together. So I would, whether you need a motion, I don't know if you want a motion, Steve, to move forward, or if you're just doing a consensus, but I would say to move forward with the RFQ and get somebody on board as soon as possible. I think the community wants to see a response, and a positive response on what how we're going to address this very sad event that happened and move forward. And I think this would be positive news for everybody.
I think I heard Commissioner Honeycutt in the background.
Yes.
Um,
Yes, you did.
yeah. And are you in favor of moving forward with the RFQ as well?
Yes, absolutely.
Commissioner Shue?
I'm definitely in favor of moving forward. The only thing that I would like for us to try to do is, whenever we do the demolition, to try to salvage some of the parts that we can to use in the new building. The beams, those huge beams and things that could possibly be used and incorporated in the new structure. I would like to see us take that into consideration, but I'm for moving forward and getting something out so the public will know we're going to move forward and put something back as soon as we can.
Commissioner Kiger, your comments?
Yes, I'm for proceeding.
Okay, I think we have consensus, so I think that will be sufficient to go ahead with the next step in the process. Does that work for you, Mike and Kyle?
Yes, sir.
Yes, sir.
Very good. Okay, well, we will move to the next item on our agenda, which is the Frank List Park lease renewal. And I think Kyle and Jonathan will talk with us about that.
Yes, sir, and board. So the process of the Frank List Park lease renewal, obviously that is two separate tracts. That was under two separate leases. In April of 2016, Deputy County Manager Jonathan Marshall started the process with the state with a letter requesting that they combined and that we extend. Also wanted to inquire about the possibilities of owning the park and not leasing it from them. The state would prefer to continue the lease, and after a significant amount of time working on this and going back and forth with drafts, the county has reviewed a draft that County staff and county attorney agree with, that extension would take both parcels, so the entire park, out to 2054. Our main two issues with the verbiage that has been in the different draft versions that we have seen is there was some stormwater verbiage in there that I had some issues with, and the state was able to clarify that. And the last part, and it still exists in this actual draft lease renewal, is that the state retains the ability to terminate the lease at any given time throughout the entire course of the lease extensions, which, just for what it's worth, that exists in the current lease they have now. But they were much more detailed about terminating the lease, how many days they would have, and what we would have to do to all of the amenities that the county has put in out there. And they basically gave us an option to remove all those amenities at our cost. And I'm sure you understand that that can't really be done.
So is that the final, I mean, do we have an opportunity to negotiate those points back with the state before entering into this agreement?
I voiced to the county's displeasure with that verbiage on 3 different occasions, and I was given the same answer each time, that it's not coming out, and that they feel that for $1 a year, they should be able to terminate that lease.
What is the expiration date of our current agreement?
2025, I think.
Yeah, it's actually 2 separate dates. I'm bringing it up right now, sir. I
Yeah.
believe that it's expiration in 2025.
2025 on both agreements?
29 on the actual park, the soccer complex. We had renewed the park lease at one point, so it was 2029. So we requested an extension, and they put that in the lease to 2054 and combined the both in one.
Okay, so as we go forward in this process of getting requests, proposals on the major structure out there, is it unreasonable that we might delay the entering into this agreement for several more months until we get have a better handle on some of those issues?
Yeah, I think we can do that so we can have more conversation with them, and it may allow us to have them change their mind as we move forward with the sizable investment.
Right. Commissioners, did any of you have any questions or comments on this item?
I can only assume that the people that we're talking to in Raleigh about this lease, are they aware of the burning of the barn?
Yes, sir. That was my 3rd call that morning.
Okay, any other questions from commissioners or comments?
Not for me.
None for me.
Okay, then I will say that we probably have consensus to delay on entering into this agreement for this new lease agreement until we have a better handle on the situation with the barn and other items. Is everybody okay with that?
Yes.
Yeah.
Yes.
Okay. And that works for you, Kyle?
Yes, sir. Thank you very much. I'll let the state know.
All right. Very good. We move to our next item, our innovation and technology innovation report, and we're happy to have Debbie BRANNAN to deliver that.
Good afternoon. I think you all are living innovation this afternoon. I wanted to start off with remind you about our employee digital book club. We're still doing that, and this month we're doing the Nature Fix and Born to Walk. So as people are looking to get some exercise, get out and get a little walk in, and don't forget to report your steps to Walk Cabarrus. This weekend, I read the state of New Jersey was seeking COBOL programmers to help fix their mainframe unemployment system that is being overwhelmed by the pandemic-related job losses. To put that in perspective, I started working at Cabarrus County as a COBOL programmer in the late 80s, and Cabarrus County migrated away from mainframe COBOL systems around 20 years ago. A little less than 1 year ago at the May 2019 Board of Commissioners work session, I provided the first innovation report introducing you to Cabarrus County's innovation initiative with the goals of creating a culture of innovation, expanding and improving the use of existing resources, and visualizing a county operation. In reality, Cabarrus County has been innovating and continuously improving over the last 20 years. This pandemic has forced us to shift the county's service delivery and business operations to safely provide essential services. As these changes are being made, I find myself thinking how lucky we are. How lucky are we that we are not in search of programmers to support legacy software applications like New Jersey. Last year, we migrated from a timesheet application written by a programmer who is now retired. We are now on Kronos workforce solution and can quickly make adjustments as workforce requirements change during the pandemic. How lucky are we that we are already using Microsoft Office 365? So we were able to quickly enable secure work from home solutions for employees with high risk factors of severe illness if infected with COVID-19. How lucky are we that we can keep construction moving in our county through the online service Excella Citizen Access. And we had just deployed a new, easier to use electronic plan review room, e-permit hub, integrated with Excella. How lucky are we that we have Microsoft Teams in place for virtual meetings like this one to collaborate with coworkers and continue vital operations safely using video. The staff at the Department of Human Services is continuing to provide access to benefits using Teams to greet and interview customers via video conference. And construction standards inspectors are using Teams to conduct indoor video inspections. How lucky are we that our innovation team had the skills to quickly spin up COVID-19 tracking dashboards for the Health Alliance and emergency management? How lucky are we that our network team was in the process of evaluating new cloud communication systems, so we were able to quickly deploy new Cabarrus software phones already vetted and tested that allow employees working from home to answer calls coming into county offices. 1,419 calls were answered by work from home employees last week. How lucky are we that over the last 20 years, the Board of Commissioners continued to invest in technology, and the IT staff was able to forecast and ensure technology systems and infrastructure kept pace with the changing requirements. In the last 20 years, we have gone through significant transformational technology changes, from COBOL mainframe data processing to mobility and cloud services. Thomas Jefferson is attributed to saying, "I'm a great believer in luck, and I find the harder I work, the more I have of it." So I'll wrap up with this innovation report by saying, how lucky are we that during this pandemic, our departments are innovatively using existing technology and resources for a transparent and accountable government and to support the health and safety of our community. Thank you.
Thank you, Deb. That's certainly good for you to point out some of those things to us. And in no small matter, you and the IT staff have been very much at the forefront of making those things happen. It's only when we enter into a situation like that we are in now that I think we can truly appreciate all those things. If you had asked any of us 2 months ago If we would be employing all this technology for the things that you described, I don't think any of us would have thought that that was possible. So hats off to you and all of the Cabarrus County staff members for the excellent job that they're doing, continuing to provide services to our citizens when it's a little less convenient. But we're very, as you said, we're very lucky to have the technology to be able to do that. So thank you very much. Commissioners, do any of the rest of you have comments?
No.
Well, I'm happy to answer the question that Debbie asked. We are lucky indeed.
Absolutely. Okay, well, thank you very much. We'll move now to discussion items for action. First up from Finance is Cabarrus County School Agency and lease agreement for a new middle school. And we're happy to have Susan FEARRINGTON to talk with us about that.
Enclosed in your work session notes, there's an agency agreement and a lease agreement for the middle school that we're going to be constructing pretty soon. And just to let you know that the county holds the title to each of our properties as we're building them and for the duration of the debt. So we have a title to the land for the new middle school, and we will work with that the Cabarrus County Board of Education during this time. We will lease the property to them so they can be our agents. And then also we have the agency agreement that lays out everything. So part of your agenda package for your approval on the third Monday in April will be to approve the agency agreement and lease agreement for the new middle school. And one of the benefits that we have with holding title to the property is that we get to retain the sales tax on the construction contractors' sales tax that we get back. And that money is used to maybe help with some shortfalls on the project or to be used for debt service through the years. And just to give you a little bit of history, I was looking back at the Royal Oaks Elementary, which we built a couple years ago. We were able to obtain $362,000 for that project. And for the middle school in Mount Pleasant, $496,000. So that money was being able to use for, like I said, some shortfalls or for debt service through the years. We're on track for the high school right now. So far for the high school, we're not finished with the high school. We've collected $800,000 on contractor sales tax. So those are all good things. So it's a good thing to have the title in our name for that purpose. Any questions?
I think that's pretty standard for all of these projects. Commissioners, are there questions for Susan?
None from me.
None from me.
None for me.
Okay, well then we'll move to item 4.2, which is also from Finance, and Susan will lead us in that discussion.
Okay, Kyle and I'll be actually tag teaming this one. So the furniture and equipment budget for the new courthouse project needs to be increased by $800,000. And there are sufficient contingency funds that we can tap into for this project to cover the $800,000. And so I'm going to let Kyle tell us about the need for this change.
Yes, so this change is to take that contingency funding and put it into our FF&E, or furnishings and finishes that go throughout the building. What we've done is identified a bunch of materials that were in Messer's contract, security cameras, card readers, fixed seating, that actual state contracts exist out there that would be a lot more cost beneficial for the county to utilize them. And after speaking with Todd Shanley, we asked that we would pull those out of the Messer budget and out of their GMP2 and move them into our FF&E budget. To be able to utilize some of that funding. Now, how this is written, and the estimated GMP, the schematic GMP for GMP2 is to say the same amount. So if you remember last month when I came in front of you and started talking about the different finishes and things that we were looking at for value engineering, this is so that we don't have to go down that road of all that value engineering, because what we had identified was about $2.5 million that we would have to come up with value engineering. Things like terracotta, different hard wall finishes, different HVAC components. So this is to try to alleviate that by basically moving some of those materials out of Messer's GMP and utilizing our state contract discount and the vendors that ITS and both IM would like to work with, and save that money, which would also save money on the management fee that Messer applies to those materials.
Okay, questions for Kyle?
So Kyle, the other $1.1 million or so of needed changes in the GMP, you guys were able to value engineer the others out. This year is to keep the most important ones, the most important features.
Yes, sir. We were able to value engineer out some different grades of drywall in some of the back of the house areas. So not the highest finishes in some of the back house areas and some of the utilitarian areas. We did not remove any terracotta or anything that would be in the public areas.
Okay, other questions for Kyle? All right, thank you very much. We will move now to item 4.3 from Human Resources, emergency leave pay, and we're happy to have Lundy Covington to lead that discussion.
Good evening, Commissioners. I believe my topic is emergency leave pay, but a lot of this is going to be about the Families First Coronavirus Response Act. I'm going to try to do a screen share real quickly so you can see a presentation. Okay, I hope that's visible to you at this point.
Not for me.
No.
No? Bear with me. There are a few items we would like to ask for your approval this evening. Share is on. And help is on the way.
We are all learning a great deal this week.
For some reason that's not. While help is trying to get the presentation pulled up, I can go ahead and start walking you through it briefly. Yes.
There's a brush out here.
So there are two basic provisions of this act. There is one for emergency family and medical leave, and the second portion is on emergency paid sick leave.
Janie? Janie?
I'm going to continue talking if that's okay. Can you hear me?
Yes.
Yes.
Okay. So again, the two provisions, there are, I took my presentation away. So there are several categories that qualify under the leave. There are three that I would consider personal medical situations for quarantine, self-quarantine, and signs and symptoms of coronavirus. There's also three categories of what I would call caregiver leave. Those are at 2/3 pay. They include care for a quarantined or self-quarantined individual, child care, and then there's a substantially similar provision. In addition, there are some exclusions under this act, and we've been getting guidance from the School of Government, UNC School of Government, on what that could pertain to. This includes DOL guidance on who qualifies as an emergency responder. There are multiple categories, and I tried to match this up or compare it to our definitions here at the county. Basically, it would be all of our public safety positions, including law enforcement officers, firefighters, emergency medical personnel, 911 dispatch or telecommunicators, all of our emergency management personnel, and also our detention officers. So again, that group can be excluded from the act. What we would like to ask the commissioners for this evening is the ability to include those first responders. So instead of having them left out for pay purposes, we would like them to be approved for those first 3 reasons related to personal medical conditions. This would be up to 80 hours for our full-time staff for paid sick leave, or a 2-week equivalent for our part-time staff. The second item we would like to ask for consideration outside of the act, under those last 3 reasons, 2/3 pay is allowable. We would like to be able to provide the ability for our employees to utilize their own pay to make up that gap, that additional 1/3. That way they could be in a 100% pay situation if they were out for a child care reason. The third thing we would like to mention, and it's actually beyond FECRA itself, is to consider additional sick time if that's needed. For example, if we have an emergency responder who utilizes 80 hours of the family's first leave time, comes back to work, has a secondary exposure, then we would like to be able to allow additional sick pay in that situation. Again, this would be where there's an exposure at work. Primarily first responders, but there also could be some situations where we have other staff members who are working out in the field who may have an exposure. So with appropriate approvals from the department head, safety, risk management, human resources, and our employee health and wellness center, we would like to be able to do a little above the FECRA law for that group. So I think we finally have the presentation up. Maybe, and that's basically what I wanted to point out this evening, including the 3 categories we'd like to ask for your approval. And if possible, we'd like to see if that vote could take place this evening. We are in the effective window for this act. It started April 1st. So we are in need of getting some communication out to staff as well as some forms out to them. And based on your decisions, that will impact how we put out those forms. Are there any questions I can answer?
Lundy, thank you for bringing this to us. I think this is important for us to do and to move forward with it tonight.
Any other questions for Lundy? Hearing no other questions, and we had some previous conversation about this, I'm very much in favor of doing this. Do I hear a motion that we suspend the rules so we can take action on this tonight?
So moved.
Second.
Okay, we have a motion to suspend the rules made by Commissioner Poole, seconded by Commissioner Honeycutt. Is there any discussion? Hearing none, all in favor, please say aye.
Aye.
All opposed, no. That passes unanimously. Would now entertain a motion.
I will make a motion that we provide the time available as has been outlined by Lundy, and that we go forward. That the most important thing for us to do right now is to support our employees who are frontline and who are putting themselves in harm's way because they're not allowed to be sitting at home like we are today. So I think it's very important for us to move forward with this immediately. So I would make that motion.
Second.
Okay, we have a motion by Commissioner Poole, seconded by Commissioner Kiger. Is there discussion? Hearing none, all in favor, please say aye.
Aye.
All opposed, no. That motion passes unanimously. Thank you very much. I certainly agree with everything that Commissioner Poole has said. These are the folks that we really need to be taking care of right now. We've all heard some of the comparisons and comments. The hard things that they're having to do, the rest of us are just asked to sit at home and watch TV, and we'll wonder if we're messing that up. So certainly want to take care of those folks, and thanks to all of them for everything that they do. And so now we will move to item 4.4, planning and development, the 2021 home program. And we're happy to have Kelly SIFFORD with us.
Thank you. As you may recall, we talked about this program in January and did a public hearing. The project we were planning on working with Concord was through their Opportunity Zone funding, have decided not to use home program funds with that. So right now I am proposing that we partner with them on constructing a new home at 96 Chestnut Street in Concord. They own the property. We would construct the home. This plan was come up with about a month ago. I do have some concerns about it, but we do have a deadline we've got to meet. So we're going to go ahead and propose this and do this now. We're going to give it a little time because I don't want to get in a situation like in the recession when homes were constructed and if you couldn't sell it, you had to rent them. So if we see that this is not going to be a viable option, I will come back to you with probably some combination of rehab or down payment assistance to a program such as Prosperity Unlimited. But we have a little time before we would actually have to get to that point. So I wanted to go ahead and proceed today with this and just give you a heads up that I may be coming back for a third public hearing if this doesn't look like it's going to be a viable option at that time.
So, Kelly, is that your concern, is the timing of it and all, when you say you have a few concerns?
Yes, when we started talking about it, COVID was out there, but not like it is right now. My concern is that you have to be a qualified home buyer, which is fairly low income, and I'm afraid that that population may have been heavily impacted by this event, and that we may not be able to find a buyer in that area. So, if this passes over and things move along and get better quickly, that may not be an issue. If it starts to drag out, it may be an issue. So I just wanted to make you aware that if it looks like it's going to become an issue, I may come back to you with a different set of plans.
Basically, it's not the program or anything, it's just the circumstances in which we're in.
Correct. Yeah, this came up rather quickly, and so I didn't want to, tell you this and then not give you a heads up that we may need to go with a different plan.
Thank you.
Okay, any other questions for Kelly? Okay, thank you very much. We move now to item 4.6 from Planning and Development, proposed amendment to the Harrisburg Land Use Plan, and we are happy to have Susie Morris with us.
Good afternoon. What you have in front of you is a proposed amendment to the Harrisburg Land Use Plan. The town of Harrisburg amended the plan in November of 2019 to lower the residential densities. They have asked that Cabarrus County also consider amending the plan so that the densities in the plan are consistent. The map that you see on the screen shows the areas where the densities would be changed. The proposed changes are as follows. The very low density would remain unchanged at less than 1 unit per acre. Low density would change from up to 3 units per acre to 1 to 2 units per acre. Medium density would change from 3 to 4 units per acre to 2 to 3 units per acre. And high density would change from 4 to 15 units per acre to 3 to 10 units per acre. So all of these are proposed changes to lower the number of units that would be permitted in that classification for the land use plan. It does not include any type of rezonings. This is strictly based on changing the classifications in the land use plan only. The proposed changes are consistent with the currently assigned county zoning designations, and they would not create any conflicts. The first step in the process was for the Planning and Zoning Commission to look at this proposal and to provide a recommendation to the Board of Commissioners, which they did. At the January 14th meeting, they voted unanimously in favor of the amendment and to forward it to the Board of Commissioners for final consideration. So as a part of this, the next step would be for the Board of Commissioners to consider holding a public hearing to consider adopting the proposed changes. And if you remember in 2018, we did an update to the land use plan. And at one of the recommendations in that plan was for Harrisburg to go in and take a look at their unified development ordinance because some things just were not matching up. So they are currently in that process. I believe it was last month. They did hire a consultant, and the county will have representation on their unified development ordinance update team as the project moves forward. And I'd be happy to answer any questions that you might have.
Susie, so this is the land plan that was the pretty long, drawn out, significant public input that land design did? Is that, I guess I'm trying to mirror what I remember of that long process with they're already changing it. And what, if I'm wrong about that, correct me, but so what's driving the change? Two questions. Am I not remembering that correctly, which may be the case? And what's driving the change?
You are remembering that correctly. In November, there were some new council folks that came on board and wanted staff to take a look at those densities. As you know, Harrisburg has a lot of new development happening. And as part of that, the decision was made to lower those densities in those areas. As you can see, hopefully you can see the map on the screen. So yes. The areas that it talks about really are those areas that are further away from town. It still keeps the densities where the utilities and the investment are, and kind of lowers the densities in those areas where we used to have the interlocal agreement in place to where utilities would not happen for a while. Now, there has been some development in those areas, but overall, once the Unified Development Ordinance is updated, those are the same densities that are going to be adopted as part of that document. So the land use plan and the Unified Development Ordinance and the county zoning ordinance will all match up to a pretty good extent at that point.
Okay, because we approved the original plan. Is that
correct?
Right? Yes. Okay. Okay.
Correct. And then Harrisburg was looking at the densities, and I included the presentation for you. So you can see that they did, they took it to their Planning and Zoning Commission, and then also to their Board of Commissioners last fall for consideration, and the final vote happened in November with the town. So it's already in place with the town of Harrisburg.
Okay.
Okay, additional questions for Susie?
Nothing for me.
Okay, thank you very much. And we move now. Yes.
No, I just said thank you.
Oh, I'm sorry. Okay, we move now to item 4.6 from the Sheriff's Office, implementing body-worn cameras. And we are happy to have Sheriff Van Shaw and Chief Deputy James Bailey on with us today to talk about that item.
Thank you, Mr. Chairman. Appreciate it. Today we come to talk about body-worn cameras or body cams. Obviously, they are very prevalent in law enforcement today, and they provide, most importantly, an element of transparency for the citizens of the county to see what law enforcement does. It holds officers even to a higher degree of accountability. It also enhances our ability in criminal prosecution and the investigation of crimes. And so we took this past year in 2019, we completed a body-worn camera trial where we placed those on a number of officers throughout the agency. At the end of that trial, we brought them back in and we discussed the pros and cons to the body-worn camera. both through a personal survey as well as a group meeting. And all those officers unanimously were in favor of moving towards a body camera. Most law enforcement agencies of our size currently operate with body-worn cameras. We looked at a company called Axon, as well as other companies, and we felt comfortable with their product. Concord Police Department uses that company, as well as the Charlotte-Mecklenburg Police Department. So we have some opportunity to apply for a grant through the Department of Justice and Bureau of Justice Administration in order to offset some of those costs. So what we're proposing is to be able to move forward with that grant application process and look at the feasibility of putting the body-worn cameras on approximately 120 of our officers that are out each and every day interacting with the public.
Okay, thank you, Sheriff Shaw. Does anyone have questions for the sheriff?
Not me. I think it sounds like a good plan.
I know y'all have been provided a summary. I don't know if Rodney Harris wants to speak to the specifics of the grant itself, as to what we would be looking at as a 5-year contract with that company. Like I said, with grant funding offsetting some of that cost.
Yeah, I think the only thing I would add is that we have an opportunity to consider some additional revenue that the Sheriff's Department generates, so we can budget that to offset some of the cost. And then I also think there's an opportunity to look for other resources outside of this Department of Justice grant to hopefully reduce the cost. And so we think that as part of the FY21 budget, there's an opportunity to roll this in pretty seamlessly if the board is in support of it.
Okay, thank you, Rodney. Board members, did you have questions for Sheriff Shaw or Deputy County Manager Harris?
No questions. I'm in favor of it. I'm glad to see us move forward in that direction.
Very good. Well, we thank you, and we will proceed ahead.
All right, thank you.
Okay, at this point, we're going to take just a brief break from our agenda. We are very happy to have on with us Erin Shue, Interim Director of the Cabarrus Health Alliance. Erin and her staff there at the Health Alliance have done a tremendous job for the citizens of Cabarrus County during this current coronavirus crisis that we're involved in. And so we are delighted to have Erin with us today just to provide an update as to where we are here in Cabarrus County. Welcome, Erin. At least I was told that Erin was with us. She might be getting her technology in order. Well, it seems that Erin may be having a little delay there. So while she's getting set up, we're going to move ahead to item 4.7. Also from the Sheriff's Office, request to appropriate inmate housing revenues. And I think Benita Conrad is with us to discuss that.
Hold on, she's stepping into the room. Go ahead, Benita, you're on. The mic's on.
Okay. Good evening.
Good evening.
Good evening, Benita.
We are looking to cover a budget deficit in our purchase services for the detention center. We have two situations that have caused this to be over budget. We have the raise the age, where it's moved all the 16 and 17-year-olds out of the jail and into a juvenile facility. And then we also have a very sick inmate that's in safekeeping. The detention center just received an invoice for $12,000 from the North Carolina Department of Public Safety for juvenile justice, and that was the bill for December. The invoice is for 12 of juvenile offenders for 106 days. We did budget some of this, and we anticipated what DPS told us to anticipate, and we did cover that amount, but that's not going to be enough. Right now, just based on the invoices that we have, we're estimating juvenile justice will cost us about $65,000 for the remainder of the year. And as far as safekeeping goes and the sick inmate that we have in safekeeping, this inmate is not set, has not got a court date set. And we're anticipating about $12,000 per month to cover the health care for this inmate. So far this year, we've already paid DPS for safekeeping $99,500. So the estimated deficit in safekeeping is $76,000. So we're asking to reappropriate some inmate housing revenues of $142,000 and move that to purchase services to cover that expected deficit.
Anita, this is Lynn. Do we have any idea as to how long this is going to go on for this particular inmate?
I think that really depends on when the DA sets a court date for that person.
Is the reason a court date hasn't been set is because of the health of this person?
Yeah, Lynn, this is James. Yeah, that right now with the inmate being at safekeeping, he's not had adequate access to counsel, and there's been some other issues that's arose with him being in Raleigh at safekeeping. So I think that's part of the reason why we've been unable to get him in court. We've worked very well with the DA's office up to this point to get some of our other inmates out, but currently this inmate is just not going to be able to get before a judge anytime in the near future.
Okay, other questions for James or Benita?
Well, just thinking out loud again, you know, on this particular case here, you know, with the outbreak of the coronavirus, and we're having to do, like we're doing now, virtual meetings and that type thing. And then I know that when visitors come to the jail, they see whoever they're going to visit with the cameras, where they don't have physical contact, but they can see each other through the camera. And then I think I've seen some things where that our Judge McGee has had some virtual type things also that has saved the county money. And that's what I'm all about. Is there a way that this can be set up where that it can be a virtual meeting with this particular inmate and a virtual meeting with the judge?
Lynn, to that point, we've been trying to get this inmate into the courts. One of the issues that we have currently is that when you're having inmate access to counsel, counsel is oftentimes hesitant to use video visitation just for the simple fact that there's a fear of monitoring of those conversations. So you have to kind of keep that attorney-client privilege. So there are ways that you can do it, but at Central Prison at the hospital, I think that access to video visitation, and I can say again, quite frankly, the inmate's in very poor health. I think that's been some of the limitations that we've had with the council. And I don't think that's all of it. I just think that the inmate's in such ill health that's been the primary issue with getting him before his counsel or before a judge through the video process. But I do know locally, some of our attorneys are rather hesitant to use video visitation, just regardless of the safeguards we have in place. A lot of them prefer the in-person counsel visits.
Well, I'm getting an education. I appreciate you helping me on that.
Yes, sir. We are making every effort to try to get this person's case resolved. But like I said, we've had a lot of good success with the district attorney's office and the courts. But this is just one of those situations that we're really very limited in how we can approach getting him before a judge.
Thank you, Chief. I appreciate your comments.
Okay, any other questions or comments?
Well, just a quick comment. As far as the budget impact goes, this is the first year, if correct. So last year we were sort of flying blind trying to figure out what to budget. We now have a little more information to go on for next year. So when you say the 65,000 deficit by the end of, oh, it does say this budget year. I thought it said this year. I was assuming it was the fiscal year and not the calendar year. And yes, that's at the end of June. Is that correct?
Correct.
Yeah, that is correct. And again, we were given data from the Department of Juvenile Justice of what our expectations were going to be as far as costs, but obviously, as you can tell, the costs are higher than we budgeted for, which you are correct. Going into next FY year, we should have a better understanding of what those costs are going to be.
Okay. Any other questions or comments regarding this budget amendment? All right. Thank you very much, Benita and James. We'll touch base now and see if Aaron Shue from the Cabarrus Health Alliance has joined us. It appears that she has not. So we will move on now to the approval of our regular meeting agenda. All of you have copies of that before you. I think that based on our current situation, it is highly likely that we will be engaged in a virtual meeting in 2 weeks as well. On our agenda are included some items, some public hearings. Of course, at our regular meeting, we have time to hear public comments. So our IT folks and our staff are working on various plans as to how we might conduct all those items virtually, giving the public an opportunity to sign up to participate if they have public comments or to comment during the public hearings. Several of our municipalities are already involved in that process, meetings that do involve the public. And so they are also working out safe and efficient ways to conduct that business and give people an opportunity to express their opinions without bringing anybody into close quarters that might create a health risk. So I'm sure that we'll be talking about that quite a bit more between now and our next meeting. But for right now, do I hear a motion to approve the regular meeting agenda, including the necessary public hearings?
So moved.
Okay, we have a motion by Commissioner Honeycutt and a second by Commissioner Kiger. Is there discussion? Hearing none, all in favor, please say aye. All opposed, no. That motion passes. And I do get word now that Aaron Shue from the Cabarrus Health Alliance is online with us and ready to bring us an update. Hi, Aaron.
Hi. I'm so sorry my 4:30 ran long, so I hope I've not kept you waiting. Thank you for the opportunity to join your meeting this evening and answer any questions you have related to the county's response to COVID-19. As you know, our team and our Public Health Command Center, along with the County EOC, is operationalized hours of 7 days a week and working very closely with all of our county municipality staff. So right now we have, let me check my most recent numbers, we have 79 confirmed cases of COVID-19 in Cabarrus County. This does include cases that are what we call resolved, so individuals who were able to either stay at home and get better, or may have had to been hospitalized but are now discharged and better. So we're working with 2 epidemiologists to release more of that data this week. The case count of 79 also does include the 2 deaths. So the 1 individual from Cabarrus County, and this case count still does include the resident from Virginia. We'll also be changing the data report to show only the Cabarrus resident, as people are counted in their county of resident, not necessarily where they received treatment and that sort of thing. So I am more than happy to answer, or try to answer, as many questions as I can for you today. And what I cannot answer, I will be happy to reconnect with our team and get those to you just as soon as possible.
Don't necessarily have a question at the moment, but just want to take the opportunity to say thank you. I cannot imagine what you guys have been through over the last month or so, and you've done just such an awesome job. And I've had so many compliments on people who have called you guys, thought it would take you a while to respond, and you would call them right back. They said you were very kind in your response and very helpful. And in a time of this, that means a lot. So I just want to let you know how much we appreciate it.
Well, thank you. Thank you. I tell you, you know, I'm biased, but we have a great team. It's such a blessing. I've told Commissioner Morris and Mr. Downs this. It's really a blessing that we have school nurses that are part of our team who have been able to really step into non-traditional roles. But they do so gracefully, and it's actually nice to see them on a more regular basis than we would, but it's just been a tremendous team effort. I can't really say that anymore, not just within CHA, but again, working with the county staff. I know you talked about, Ms. Brannan talked about the GIS mapping. That is incredibly helpful, and it's something that our community really wanted to see, you know, how were our zip codes impacted and where was the growth. And so we look forward to continuing that collaborative work in a very positive way. We know that we are still in what I would consider our infancy of this response. People, probably the question I get the most is, when is all this going to be over? And I get it. My family wants to go out to eat at a restaurant too. But you know, we're looking at many more weeks. And so this is not something where 2 more weeks and we're going to be back to normal. And so those are the types of things that we're continuing to stress to everybody, that continue staying at home, continue washing those hands. Today, we did put out a press release regarding wearing cloth masks while you're out running those essential errands. And so we've linked to the CDC site. They've got some great tutorials on how to make a mask out of things that you have at home, everyday items such as old t-shirts and things like that. So again, I appreciate that, Commissioner Honeycutt. That means a lot, and I will make sure our team hears that as well.
That'd be great. One other question I do have is, when you hear on the TV where they're talking about different areas, New York's going to peak here and this place is going to peak here, do those estimates get down to the local level, or do you guys have statistical people that kind of figure out what that looks like for us, or is it just you have to wait and see?
Yeah, so what we know is that, you know, New York and Pennsylvania, those states are a little ahead of us in terms of where they're peaking. And so we can look to them to see their trajectory and expect, you know, not the same impact, but perhaps similar growth, or hopefully soon a decline. But we do work very closely with the State Department of Public Health and Dr. Mandy Cohen's office, and they're doing a lot of modeling and projections at this point in time as well. So
thank you.
You're welcome.
Aaron, could you address, I know the press release went out yesterday, and some of the local news channels have talked about some of the clusters of cases or facilities here in Cabarrus County. Could you talk about that just a little bit?
Sure. So yesterday we shared in a press release that we had numerous cases in 3 facilities. So one was Carolina's rehabilitation, The second is What Matters Most, which is an adult day center. And the third is 3 cases in staff members at Carl A. Furr Elementary School. And so we have worked closely with all 3 of those facilities, and again, have been met with only open arms and working with them to help mitigate further spread. And so, so we're continuing daily conversations with those facilities. And what you saw with Furr Elementary is because we knew that, you know, the cases were only in staff, and many of the questions were, well, students aren't there, so what's really the big deal? Teachers are working from home, but there is a feeding site at that school, and so we worked very closely with Dr. Louder and his staff to not interrupt the feeding for those students, because we know that's very important. They serve about 450 meals from that site a day, so that's a critical need. So we were able to, or rather their team was able to shift that to another site so that those children and those families could still be served. But for me, it was an easy recommendation to make because there are a limited number of people in that school, but we still saw an additional case, which brought the caseload to 3. So we made the recommendation to close the site 14 full days. And 14 has to do with the incubation period of the virus and when you would reasonably expect someone to show symptoms and be infectious. And so those were the decisions. The other 2 facilities have put in very strong mitigation factors, not having any new admissions. The adult day program is not having the day program, so it's not bringing those individuals together on a daily basis. So they've been great to work with and all on board with helping to mitigate the spread.
Great. Thank you very much.
Well,
other questions for Aaron?
Well, I just want to echo what Commissioner Honeycutt said. Thank you so much for all your hard work and your staff. It's, you know, going back a month ago, we just didn't really know what we were dealing with. And so all of the information that you've gotten out to social distance and wash your hands and use hand sanitizer and that kind of thing, now wear masks in certain circumstances, is all very beneficial to hopefully slow this thing down and get back to normal. It's at least at some point in time. And I got to tell you, I've washed my hands so much, I feel like Lady Macbeth. For anybody that knows, that's the first Shakespeare reference in a commissioner meeting probably since in a while. But no, seriously, thank you so much for all of your hard work and for everything you're doing.
Yeah, so our first confirmed case was March 11th, so it's day 27, but it feels like much more than day 27 from our first case. But anything that we can do to support any of you, any questions or calls that you're receiving, please feel free to forward those to us or to reach out to us, and we can pass the answer back along through you. We're more than happy to do that.
Right.
Thank you.
Hey, Aaron.
Yep.
I want to jump in real quick. Thank you again for all of your staff, but I was happy to hear your comments about the school nurses. As you know, a few years ago, the county worked with the Health Alliance to make sure that school nurses who are technically part-time employees would have the ability to get health insurance. And the idea at the time was that if there was ever any kind of an epidemic, they would be called in to help. And that's exactly what's happened. So I'm glad that we have such a good relationship between Cabarrus County government and the Cabarrus Health Alliance that we were able to realize that in fact was at some point might happen. And I also wanted to kind of a tangent on this. Not too long before this happened, you did a training out at Charlotte Motor Speedway. I know that I rode through twice and had the same, no, my husband had the same card both times. He was an infant driving the truck, but nonetheless, you did have a practice session on what would happen if there was a vaccine. So I don't know if you want to just make a few comments about the fact that you have been doing training in the event something would happen. We're sad that this has come to this worldwide, but you and Cabarrus Health Alliance and all your wonderful employees, I'm a bit partial on that also, as you know, but all your wonderful employees have really, really stepped up to this challenge You've kept us all informed as commissioners and the community. I really like those videos you put out every day. And I think they're great that you've gotten other staff members to step in every once in a while so that the community can see all the many faces of Cabarrus Health Alliance. So I don't know if you want to talk about some of the training and everything that you did, not knowing that this was going to happen. And again,
Sure.
Thank you so much.
Thank you. Thank you. So yeah, so every local public health department in the state of North Carolina has to do required public health response exercises. And so we're really lucky in that we have a public health preparedness coordinator. And so this year we had a CDC required large scale exercise. So if we had to vaccinate a large number of people in a short amount of time, we have a tiered system in which we would know how we could do that. And we have multiple sites, whether it's a small outbreak, medium, or large. We tested our medium site last year or 2 years ago. That was Crossroads Church on George Liles Boulevard. But we had never tested our large site, which was Charlotte Motor Speedway. And so before we even knew what COVID was, we had been planning for a pandemic flu vaccination exercise. We did that on the only inclement weather day in Cabarrus County this year. It was just our luck, but we did it. It's a drive-through protocol in which individuals would drive through with their families in their car. They're triaged at a certain point through the speedway track, and then they pull into the garages, and that's where they work with the nurses to receive their vaccinations. And so we were able to study the throughput, how many vehicles, how many shots could we give in a short period of time. And it was very successful. And so thank you for volunteering to come and drive through. We really wanted to kind of stress the system and see exactly what we could get through. So if there ever was a COVID vaccine that we were able to get in mass quantity, please know that we just exercised how to do that. Local law enforcement was there with us, EMS was there with us. So our partners were part of that exercise and the planning process. And so if we were ever to receive a vaccination or for a different event down the road, we have those plans in place and staff to do that. So thanks for bringing that up.
Aaron, this is Lynn. I just wanted to jump in. I'm not going to be as long-winded as some of our fellow commissioners, but I just want you to know that I really appreciate the effort that you've put into this, you and all your workers. And I know there's a lot of people involved in this, and it's all for the safety of our people, trying to keep everybody well. And if they'll follow the guidelines and wash their hands, like Blake said, and you know, we're going to get through it, and it's going to be sooner than later, I think. So thanks again for all you're doing, and just keep up the good work. Thank you.
Thank you, Mr. Shu. We appreciate it.
Great. Any other questions or comments for Aaron? Well, thank you again. You folks are doing a tremendous job. That's what you've trained for, and that certainly shows, and we're very fortunate to have you. I would like to also mention that Aaron has led conference calls at least 3 times a week, sometimes more frequently than that, with all of our municipalities. They have participated religiously in those calls, so it's been Cabarrus County, our 5 municipalities, the Health Alliance, discussing some of the issues, keeping us up to date on what's going on. When it came time for us to issue the stay-at-home order, which of course was followed a couple days later by a statewide order, it was wonderful to have all of those folks at the table. We were able to discuss issues, and we continue to do that and talk about other problem areas in the community where we think that people's safety is not being protected, to come up with the best solutions to make sure that all those things happen well. And so all of the things that we do to open up those lines of communication and to create those relationships really pay off when we're in a situation like that. And we thank you so much for your very capable leadership during this process. Great. Okay, well, I will say, Aaron did mention about the face mask. I do have mine, and yeah. And so, as I say to people, when you do have to go out to the grocery store or to the pharmacy, and we've all read these face masks when I wear this face mask, it's not to protect me, it's to protect you from me in case I should have some sort of an infection. So when you go out and you're wearing this face mask, that kind of sends a message to other folks. I care about your health, and hopefully you will care about mine. And so if we all do that, it'll help. An added benefit to the face mask is, we hear so much discussion about don't touch your face, don't touch your eyes. I find now that I'm paying attention, I do that far too frequently, and that mask helps me remember not to do that. So I would encourage all of you. You don't have to go out to a store to buy one. As Aaron mentioned earlier, there are many opportunities of all different kind of innovative ways to make face masks for things that you have there in your own home. That being said, the most important thing is stay at home if at all possible. If you stay at home, you don't need the face mask unless you go out into your yard and you have problems with pollen like I do. So that's a double duty on that. But if folks will stay at home and follow the guidelines that have been set out, we will be through this crisis so much sooner. So we really encourage you to do that. Commissioner Poole had mentioned the daily videos that the Health Alliance is doing. Those are excellent. I would encourage everybody to watch those. You can find them on your social media feeds. I know that we have been featuring those on my business's social media page. I would encourage others of you to do that. We have got so many businesses out in the community that are really suffering right now as they're closed down and can't conduct business. So that's one of the things that they can do during this crisis is help us to spread the word about how we can all stay safe and make this end sooner. So thank you again so very much. And so now we have come to the end of our meeting, unless anyone else has anything they would like to add along the lines of comments before we adjourn. Hearing no one at this time, I would entertain a motion to adjourn our meeting until our regular meeting 2 weeks from tonight. I think I saw Commissioner Shue's mouth move, but I think he was. Commissioner Tiger seconded that motion. So we have a motion and a second that we adjourn. All in favor, please say aye.
Aye.
Opposed, no. We are now adjourned. We thank you all for your cooperation and patience. I think that our first ever virtual meeting went extremely well, and that is due to the very capable IT staff and all the folks that have worked through all these details to make it happen. So thank you, everyone. Stay safe, and we will see you in 2 weeks at our regular meeting. Thank you.